Denise.
And we're live, Councillor Fairhurst.
Thank you. So can I welcome all the board members and observers, and welcome to this meeting. This meeting is being held remotely and members are in attendance via video conferencing. This meeting is being live streamed and will also be available for repeated viewing. During the meeting, if a member wishes to speak, they will indicate as requested and we will call them to speak in turns. Member services will check for raised hands or people who put in the right to request to speak button. I'm going to begin by reading the names of members on the committee so they can confirm their attendance for the public record. There's myself, Councillor Liz Fairhurst, Dr. Barbara Rushton.
Yes, here, Councillor Fairhurst.
Thank you. Councillor Judith Krajewski.
Yes, present.
Graham Allen.
Yes, good morning, present, thank you.
Councillor Patricia Stallard.
Yes, Chairman, present.
Now, Simon Bryant, he's actually at another Health and Wellbeing Board meeting on the Isle of Wight, but will be joining us later. So we are expecting him. Steve Crocker.
I think Suzanne. Oh, go ahead, Suzanne.
I'm here for Steve Crocker, Suzanne Smith, Assistant Director of Children's Services.
Thank you and welcome, Suzanne. Dr. Peter Bibberway.
Yes, good morning, Councillor Fairhurst. I'm here.
Good morning. Dr. David Chilvers. No, not at the moment. Dr. Rory Honey.
Present, Councillor Fairhurst.
Thank you. Dr. Nicola Decker. Councillor Anne Crampton.
I'm here, Chairman.
Councillor Philip Raffaelli.
I'm here, Chairman. Thank you. Good morning.
Good morning. Patricia Hughes.
I'm here, Chairman. Thank you.
Christine Holloway.
Hello, yes, I'm here. Good morning, everybody.
Morning, Christine. Angie Kimberley.
Good morning.
Right. Julie Ames. Julie again is another one who's at the Isle of Wight Health and Wellbeing Board, but will be joining us later. Paula Anderson, who's here as Deputy for Ron Shields. No. Rob Cole.
Chair, sorry, I think Paula Anderson is here.
Oh, Paula is here, is she? Good. Rob Cole. No. Mary O'Brien.
Hi, yes, just logged on. Mary O'Brien, NHSE&I Deputy Director for Strategy and Transformation, South East.
Thank you and welcome, Mary.
Thanks.
Are there any deputies that have not called?
Did you call my name? Roy Perry.
Sorry. Was that Roy?
Yes.
Ah, okay. Welcome, Roy.
Councillor Fairhurst, Fairhurst is Nicola Decker. I've joined late. I'm so sorry. Hello.
No, it's okay. Welcome, Nicola.
Thank you.
Now, is that everyone then? That's good.
No, sorry, Councillor Fairhurst, it's Alex Whitfield here. I'm here on behalf of the acute hospital sector.
Thank you. Welcome, Alex. All decisions will be in this meeting will be conducted through a vote conducted by a poll saying against, abstain and for, and members will indicate their vote by clicking unmute and sharing the option they support. The vote will be conducted by a Democratic and Member Services officer and then the result confirmed before moving on to the next item. I would like to remind members that the Constitution standing orders will apply to, so please keep your microphone muted unless you have been called to speak, and that you may be visible on the screen to the public and to other members even when you are not speaking. Samaya, have you got any apologies for absence?
I do, Councillor Fairhurst. I have apologies from Mark Cubbin, Michael Lane, Ron Shields, Dr. Sarah Schofield and David Radbourne.
Thank you. Declarations of interest. All members who believe they have a disclosable pecuniary interest in any matter to be considered at the meeting must declare that interest, and having regard to Part 3, Paragraph 1.5 of the County Council's Members' Code of Conduct, leave the meeting while the matter is being discussed, save for exercising any right to speak in accordance with Paragraph 1.6 of the Code. Furthermore, all members with a personal interest in a matter being considered at the meeting should consider, having regard to Part 5, Paragraph 4 of the Code, whether such interest should be declared, and having regard to Part 5, Paragraph 5 of the Code, consider whether it is appropriate to leave the meeting while the matter is discussed, save for exercising any right to speak in accordance with the Code. Do we have any declarations of interest?
Councillor Crampton has her hand up.
Councillor Crampton.
Oh, thank you. I've recently become an employee of the Branksome Wood Surgery in Fleet, which is part of the North East Hampshire and Farnham CCG.
Thank you. Right, if I could turn I can't see any more. So if we look at the previous minutes held of the meeting held on the 10th of December 2020, is everyone happy with the minutes? You've all had a chance to see them and you're happy. I can't see any objections, so can I assume the minutes have been agreed? Thank you. Chairman's announcements. We undertook a board survey of all members.
Councillor Fairhurst, I'm
Yes.
sorry, just that we've skipped deputations, but I just want to say we don't have any.
Sorry, thank you. That's why I skipped them. Sorry, I announced it. We have no
Not to worry.
deputations. Right, we undertook a board survey of all members and are grateful for the time that colleagues took to share their views. Now, COVID working has further helped develop the strong partnerships which was highlighted in the survey responses. This feedback will be taken forward with a view to informing and advising board sponsors as we continually review the strategy and key matrix and involvement across the board's activities. Some key themes include how we run the board for more effective debate and feedback to others to ensure it is a strong leadership forum. This includes reviewing how the board links into the system and wider partners who can influence health and well-being, including parish councils and those communities who are not widely represented on the board. The majority of suggestions align, and board sponsors will be asked to provide an update at the next meeting. Further suggestions include key topics relating to health and well-being, further broadening out the programme of work as we have been doing to include transport and the wider determinants of health. This will be taken forward in a strong work plan of both topics and ways of working. Today, we are starting with a brief update on the integrated care system and will take views from the ICS executive in due course as to the impact on board membership. Ros Hartley, the Executive Director of Strategy and Transformation, is going to give us a very quick update on what's happening. We will not take any questions at the end of this because actually we're going to do a very in-depth look at this in a future meeting. But if you've got any burning questions, please feel free to email them in and they will be addressed. Okay, so can I just say welcome to Ros?
Thank you, that's me. Thank you, Chairman. Great. So I'm just going to give you a very quick briefing on the white paper, and particularly, I can hear a little bit of echoing. Great, thank you. On the white paper, and particularly give an update on where the Hampshire and Isle of Wight integrated care system also is. So I'm just going to talk to you really quickly what's in the white paper, the real headlines, sort of what is not in it, and where we are in Hampshire and Isle of Wight. And being very clear from the outset that there's a significant part of Hampshire, both in half of Hart and all of Rushmore, and the northeast Hampshire and Farnham element of, or the northeast Hampshire element of Hampshire, that is actually within the Frimley ICS, and lots of people on this Health and Wellbeing Board have a foot in both camps. So just really quickly, the white paper was launched on the 11th of February, and it sets out legislative proposals for a health and care bill, which is due to come into force April 22. And it builds on various health and care plans over the last few years, and particularly puts in some powers to support the collaboration that we've seen over the last 12 months during COVID, and how we've really worked together. What it doesn't address some of the reforms to social care and public health, which will be dealt with later in 2021. So the aim of the white paper is really to make our joint working, and we've just talked about collaboration, that joint working more effective, and particularly in two aspects. Firstly, between the NHS. So we know that the NHS is quite complex, a lot of different organisations. So how to make it more effective between the NHS, and also just as importantly, more importantly, is between how we work more effectively between all our partners involved in health and care, so that collectively we improve the outcomes for people and our residents. The white paper also outlines that there's going to be a duty to collaborate. And there's two things that are underpinned how this is going to happen through the proposed legislation. Firstly, at place. So how do we integrate between the NHS organisations and all our other partners to deliver improved outcomes to the health and well-being of local people? And secondly, how we work across the NHS in the main, but with other partners on provider collaboratives, how we work together. And there's a lot of things in the white paper that still need the specific detail to be worked through. So the Hampshire and Isle of Wight integrated care system, where we are on that. We've been on this journey for several years, and for us the white paper will be about how we build on this, and from how we've worked over the last 12 months on a whole range of things, worked collaboratively together with partners, and how we do that going forward. Some of the things we've still got to work on. So in the white paper, it sets out some specifics around how we will set up an NHS body and how we will set up a health and care partnership with our wider partners. Those are the statutory must-dos. But under that, there's a lot of things that we still need to work through. So what's the substructure beneath that top level structure? How do we define place? There's a lot of conversations around place, and there's a lot of people who we all have a different view of what place is. There's another key thing that we'll need to work through over the next few weeks and months about how do we incorporate and maximise our existing structures. The health and wellbeing boards are going to be really key to that. So how do we really involve the health and wellbeing boards in improving the outcomes to our population? Another thing that we'll need to work on over the next few weeks and months is how do we work at the boundaries? I've spoken about the Hart and Rushmore populations. How do we work at the boundaries? How do we cover some of those issues around coterminosity and those areas that aren't coterminous, and how do we handle that? And the final thing from me is how over the next weeks and months, both through the Hampshire and Isle of Wight ICS and the Frimley ICS, how do we co-produce it with people to get this right? So just in conclusion, the white paper, I think we would really welcome the contents. It builds on what we've been doing anyway. It supports the plans and supports what we've achieved to date, but helps cement some of the structure a bit further. There's a number of things we still want to work on with you and our partners over the next few weeks. And over the next few weeks, there will be a lot of guidance further coming out on tackling some of those and giving us guidance on some of those issues around place, structures, engagement, co-production. So for me today, I just want to propose that we note the contents of the white paper and that we propose a further, more in-depth discussion, as you've just outlined, Chairman, at the beginning, to really discuss some of the issues that aren't set in stone and how we work together at getting this right going forwards. And I would propose that we do that both from the Hampshire and Isle of Wight ICS perspective and from the Frimley ICS perspective, and we've got representation through Peter Biggleway from the Frimley ICS today. And other members, because I know quite a lot of people sit on both. Thank you.
Thank you very much, Ros. Can I ask, as I say, any questions, if you could email them in, but can I ask the Health and Wellbeing note the contents of the briefing paper and the direction of travel being taken by the Hampshire and Isle of Wight ICS as it develops? Everyone happy? Thank you.
Chair, if I can
if you just want to add something, sorry.
Yes, just to note that it obviously reflects the Hampshire and Isle of Wight ICS, but clearly doesn't intimate any activity for the Frimley ICS. And I think it's important to note that it references one and not the other.
Thank you. Graham, to say something.
Yeah, thank you. So the vast amount within the body of the update from Ros, and indeed her comments, they cover any and all ICSs. And of course, the point I guess I would want to make for this board is that clearly within the white paper is the place of health and wellbeing boards. And the Health and Wellbeing Board clearly covers the whole of Hampshire. So to some greater or lesser extent, it goes without saying, but it's important to say, Ros has said it, that future consideration by the board through a detailed, I would suggest, workshop type approach will need to apply to the whole of Hampshire. Our geography is complicated, but I really don't want to, at this point, go down any particular rabbit holes, but clearly within the white paper is also reference to co-terminosity with upper tier local authorities. It's too early, the legislation has not been laid in Parliament, but certainly by the time we hopefully come back together and discuss this in depth, there will be increased clarity in terms of what the shape of ICSs will be in due course. Thank you.
Thank you, Graham. Nicola, did you have a very quick comment?
Yes, I suppose I just wanted to point out that the objective of this white paper is to improve collaboration. And what we've learned through our health and wellbeing journey is that the way we work within the different tribes in the NHS, as well as with the councils and local authorities, are fundamentally quite a different way of being, often because of funding, but also how we work. And I think if as a group we could commit to exploring a deeper understanding of us and how we work, we will be ahead of any national guidance, and that actually we need some real support and curiosity about each other's ways underpinning any statutory change, because that will be what delivers the outcome, not the statutory change.
Yeah, I think you're absolutely right. Thank you for that. Patricia, did you want to come in? Patricia Hughes?
Yeah, absolutely. I'm going to agree with everything that's been said so far. The only concern that I have is that I know the pace at which Frimley is operating at, and it's moving forward very quickly. So I put the question into the chat, and I appreciate that not everybody can see that, and obviously the public can't see that. So my question really is around how the Hampshire Health and Wellbeing Board can actually engage as a committee rather than individual constituent parts of that committee into the conversation at Frimley, recognising that Frimley is actually talking about having much of this essentially baked in by June, which is that date of our next meeting. So I'm just raising that question, that I completely understand the opportunity around a workshop session to really have those conversations which Nicola's just referenced around how we work collaboratively together. But if I just say, and I will reference something I said yesterday to somebody, I feel a bit like a polar bear with my front paws on one iceberg, my back paws on a different iceberg, and the two icebergs are drifting slowly apart from each other. And I'm desperately trying to bring those icebergs back so they can actually talk to each other, because there's polar bears having parties on either side and having conversations, but I'm that polar bear in the middle with those icebergs slowly moving apart. So my apology for that illusion, but essentially the iceberg that is the Frimley system is drifting much quicker, and I just want to bring those conversations back into one place.
Thank you. I would hate to think that we're polar bears going in opposite directions, Patricia. I hope we're all aiming for the same thing, which is a joined up service to our residents, which benefits our communities. Christine, very quickly, because we do need to move on at some stage.
This was just a quick question. Is it in our power to alter the boundaries of the ICS, or is it set down in the white paper?
I'm going to ask Graham to answer that, because I don't think, I'm not sure what's happening about that at the moment.
Can I help you, Councillor Fairhurst? It's Dr. Rushton. It isn't set down in statute, and boundary discussions can occur, but I can't say whether they're happening here, and I don't think that this is the time or the place to discuss that.
No.
No, that's fine. I just wanted to know what the rules were.
Thank you, Christine. Thank you, Barbara, for your very diplomatic answer. Can we all now just note Roz's and say thank you to Roz for her briefing note? And if we can move on now to the Healthier Communities theme focuses, and our presenters here, we've got Councillor Dr. Anne Crampton, Board Sponsor for Healthier Communities, Abby Twat, Senior Public Health Practitioner, Hampshire County Council, Sharon Collins, Director at Shared Ventures, and Rosie Fowler, Hampshire District's Health and Wellbeing Project Officer. So if Anne, are you going to lead off?
Yes, thank you, Chairman. Just by way of introduction, the pandemic has brought economic hardship, social isolation and increased loneliness, but it has brought people together and put a spotlight on systems showing where gaps occur in the support for communities. The need for agencies such as local authorities, the NHS, the voluntary sector and communities to work together has been highlighted in a way unimaginable before the pandemic. We now need to build on this strengthening of partnership working to support our communities in the recovery phase and beyond. In January 2020, the Healthy Homes Needs Assessment and Workshop highlighted areas such as workforce development, which has led to a shared understanding of the wider determinants of health across our organisations and has strengthened the relationship between teams. The importance of good quality homes and access to green spaces for our physical and mental well-being has been emphasised and has been incorporated into designs for some of our new developments. Homelessness has been addressed as a priority because of the pandemic and has resulted in some truly inspiring outcomes. All these areas will be covered now in more detail in our presentation, and I'd like to hand over to Rosie to explain the great work that's been going on across our Hampshire boroughs and districts. Rosie.
Thank you, Councillor Crampton. As you could see in the previous slide, the Healthy Community strand of the strategy has three main priorities. I'm going to start by talking through what we have been doing around the family, friends and community priority, which is all about supporting communities to be more resilient, building social networks and helping to reduce isolation. The COVID-19 pandemic has highlighted the importance of resilient, connected communities and social networks. As you'll be aware, local communities have been central in the response to the pandemic through the delivery of local response centres and schemes to support our communities who are most vulnerable. Local authorities, the NHS, voluntary sector, community groups have all collaborated in ways we never would have imagined prior to the pandemic. Relationships and knowledge have been strengthened, and this will stand us in really good stead for the future. We wanted to share some examples with you of the partnership working which has been going on across the system to support our local communities during the pandemic and beyond as we work towards recovery. Some of these initiatives existed prior to the pandemic, but many are new to meet emerging needs, and this includes things like community pantries and other food initiatives to support our families who are struggling to make ends meet, such as the Gosport Food Partnership. There's also employability support schemes to assist people moving into work, training or other opportunities, such as the Heart Employment and Skills Hub. and community grant funds have been made available, such as the grant in East Hampshire, which funds projects to improve mental health and reduce social isolation. The pandemic has exposed inequalities in our communities, and you're all aware of the brilliant work of the Health Inequalities and Prevention Board. Other work to address health inequalities includes the Healthier Communities programme in North Hampshire CCG and targeted work with our Nepali community in Rushmore to raise awareness of key public health messages and aim to increase uptake of the COVID vaccine. I'll now hand over to my colleague Abby Twaits, who is going to talk through the work we've been doing to help keep people safe at home.
Thank you very much. So under the Healthy Homes umbrella, there's a really broad range of partnerships and programmes, all aimed at keeping people safe at home and focusing on that collaboration between housing, health and care. So we've updated the board in previous papers and presentations that the Healthy Homes Working Group was established in the summer of 2020 to take forward the priorities identified in the Healthy Homes Needs Assessment. One of these priorities was to strengthen multi-agency working through joint training opportunities. And so to understand these training needs much further, we produced a survey which was circulated to frontline staff across the system, and we received over 260 responses. So the survey recommendations included the establishment of a joint staff training induction offer across housing, health and care, based on the shared determinants of health, which should lead to a much more efficient and positive pathways for individuals who use our services. So the working group has taken this forward, and this includes the creation of some short educational videos and topics highlighted in the survey, such as disabled facilities grants, who has the duty or the commitment to refer to homelessness prevention services, and what is social prescribing and how do I access it? So we're also looking to develop some organisational champions to act as the go-to person for each team to act as the person for any queries or concerns. And we were really pleased to see that our work plan aligns with a top tips paper recently published by the King's Fund last month. So the working group will also be exploring to establish a potential Health Begins at Home memorandum of understanding, which would allow organisations to make a commitment to using homes to improve long-term health outcomes of our communities. And we would like to invite the board to support a rollout of this once it has been developed. And lastly, the Healthy Homes Working Group are also taking forward an action in the Health and Wellbeing Board business plan to support effective home adaptation processes. The council is working really closely with our district partners to understand the current policies and processes in each local authority and to better understand the equity of provision. Any transformation to current practices would of course require co-production with our district partners and the appropriate resource to do so. And so for now it's recommended that the board receives a status update on the current DFG process at a future Health and Wellbeing Board meeting to aid the decision process on the next steps. I'll now hand over to Sharon, who's going to talk us through some homelessness prevention work.
Thank you so much, Abby. My name's Sharon Collins, and myself and my colleague Patrick Fowler have been commissioned by the Hampshire and Isle of Wight STP to lead on collaborative action under the Keep Well Collaborative banner, bringing together health, housing and social care alongside other statutory and voluntary agencies. And we do this to improve the health and wellbeing of local communities through a focus on the home. One of our core priorities is the reduction of health inequality, and I've been asked to talk to you today about the impact of the remarkable collaborative effort across the Hampshire and Isle of Wight footprint to support the COVID response for people experiencing homelessness. You'll recall the government's stay-at-home directive this time last year was critical in controlling the first wave of viral transmission, but if you haven't got a home or if you're sleeping rough, that's impossible to achieve. National data suggests that if you're homeless, you already experience some of society's worst health outcomes. You're more likely to die young, have unplanned hospital admissions, and more likely to have chronic or co-occurring illness. So I'd like to start by talking about the scale of this remarkable effort by our health and social care and local authority partners right across the geographical footprint to bring everyone in. From the Isle of Wight in the south to northeast Hampshire, Hart and Rushmore in the north, from the New Forest to Havant, including our unitary partners on the Isle of Wight, Portsmouth and Southampton. And homelessness is not a start and finish activity. Numbers change all the time, and we're in the process of updating our collective system view of homelessness. But you can get a sense of the scale of the data that we collected in March last year, bringing together for the first time broader system insight on the levels of homelessness across the geographical footprint. And we found that there were 1,700 people who were homeless. A high percentage of those had underlying physical and mental health conditions, and a large percentage, although registered with the GP, had many unmet health needs. The impact of coming together as a system enabled a growing momentum and appetite to work collaboratively, and I'd just like to highlight some of the outcomes that we've achieved together. Firstly, there's been a growing multidisciplinary team approach with a number of task and finish groups established, ensuring that we link health with housing at a local level and in the way that we transform access to mental health and services for adults and older adults across the system, radically changing the design of locally accessed community mental health services as part of that broader transformation of the healthcare system. There's also been the development of a primary care homelessness healthcare specification with that brings consistency, improves access to GPs at a local level, and that's with CCG colleagues for their review. And we've also worked hard in the implementation of acute hospital discharge pathways for people presenting homeless, with this last month mobilising specialist mental health and housing in reach at QA Hospital, specialist housing outreach services alongside the ambulance service for the first time. And this sustained focus on partnerships, learning how we fit together as a system and support people facing multiple disadvantage in a different way, in a way that seemed impossible before. And that really has recognised the benefits of working at a system level, but also enabling a local focus. And that's been driven by a changing narrative, shared learning, live learning, stretching thinking, home increasingly being seen as the underpinning social determinant of health. And that's contributed to the development of a common purpose, particularly seen with the work that we've done around the MHCLG, Changing Futures expression of interest, strengthening ties to strategic housing officers groups, including partners from the Ministry of Justice and the police. And although we've not been successful in being invited to apply for formal bidding, there is sustained appetite to transform whole system transition and discharge points to stop people inadvertently falling between the gaps in services. We're also mindful that as a system, homelessness is not the only driver of people experiencing multiple disadvantage. We know that of the people brought in, a large percentage will need wraparound outreach-based support to sustain their existing placements in emergency accommodation or in shared housing to help them step out and lead their best life. System partners are also beginning to see pressure building with people presenting with deteriorating mental health. Citizens Advice colleagues reporting increasing numbers of people seeking help with increasing levels of debt, footfall increasing as people share their concerns with local authority partners about rent and mortgage arrears, and a predicted surge in pressure across the system as furlough ends and the moratorium on evictions is expected towards the summer and into the autumn. I think I'd like to just finish by saying the art of the system response to COVID has proved the art of the possible. It's accelerated that broader system collaboration in ways that we would never have imagined. And a key enabler of that is the recommendation with you today to explore the development of a Health Begins at Home Memorandum of Understanding, which provides opportunity for health and housing policy to come together at a strategic level, because without a home, nothing else can fall into place. Rosie.
Thank you, Sharon. As you're all aware, COVID-19 has highlighted the importance of good quality homes and access to green spaces for our health and well-being. The built and natural environment priority of the healthy community strand of the strategy aims to ensure new developments are designed with health and well-being in mind, which means ensuring access to green spaces, facilitating active travel and encouraging physical activity. Coordinated efforts across partners are essential to ensure new development plans enable healthy, active lives and have sustainability at their heart. The Whitehill and Borden Healthy New Towns in East Hampshire is a really good example of where this approach has already been delivered. And these principles are also central to the Many Down development in Basingstoke and Wellbourne Garden Village in Fareham, which are both in the planning stages. Many people turned to walking, cycling, running, and other outdoor exercise during the pandemic as our physical activity options were reduced. In October 2020, Hampshire County Council's new walking and cycling principles were presented at Hampshire's first Active Places Summit. The outcomes from this summit will help to inform Hampshire's local transport plan, which is also on the agenda today. And there's a wide range of local projects and schemes in existence across Hampshire, which aim to encourage more people to be physically active in their local communities. And this includes walking for health schemes delivered by local councils or the voluntary sector. There's also physical infrastructure projects such as new place spaces, which are designed to engage a broader age range, and community gardening projects as well. So that was a summary of some of the work which has been going on across the county to support the development of healthier communities. The Healthy Communities strand is a very broad part of the strategy, and we have tried to summarise it as best as we could within 10 minutes, but please do refer to our paper for further detail. And this slide outlines our recommendations for the board, which we've talked through already. So thank you all for listening, and I'll hand back to the chairman for any questions.
Thank you, Rosie. Can I just say to Sharon, I think the work with the homeless has been really effective and good. It's just really disappointing that it took a pandemic to get us all working together to achieve that aim. And I hope the lessons and the work going forward will continue, even when we're not in this situation any longer. Members, can I turn to you for questions? Christine, you've had your hand up all the way through. Is that a legacy hand from the previous item? It's a legacy hand. Okay. Nicola?
Thank you. Sharon, the homeless work and addiction services, I recognise your brief was the homelessness purely, but they overlap so much. You mentioned addiction services and the moratorium on that. My sense from talking to colleagues who work in the addiction service, a bit like homelessness, is it's often the forgotten bit of the health service that we underfund and under-resource. Do you see that changing from your lens and what you presented, or how we can help thinking health and investment there?
Thank you so much. Yes, I certainly think that the appetite and the awareness of the level of health inequality has really been brought to the fore, not just in Hampshire, but nationally. I think the invisible are very visible and have remained visible, and there is real appetite to bring a consistency to the access to healthcare. And part of the work that we have been doing with local authority and housing partners is to develop a specification. We've co-produced a specification that has the voices of people's lived experience within it to improve the healthcare that's accessible for people experiencing homelessness. And that very much moves us from a model of where people attend appointments to a more outreach type basis. Thank you.
Sorry, I was muted. Alex, your question.
Thank you very much. This is really inspirational, all of the amazing things going on. And my question really is, lots of this feels like it's happening in parts of our geography. because, you know, enthusiastic, committed people have got together and say, I want to do something here. How do we, but this might not be a gap, so tell me if I'm wrong, but how do we upscale it so it happens consistently everywhere? You might tell me it already is, but the flavour felt like we've got some brilliant things happening, but it's not the same everywhere. So I'm just wondering how we turn it into a more widespread initiatives, because all of the things you talked about were fantastic.
I'm happy to take this question. So we've got, there's really good work happening in each of the districts and boroughs, you're right, but we have recently, well, fairly recently formed a districts and boroughs community recovery forum where we bring representatives from all of the districts and boroughs together and really share that learning of what's happening in each of the areas and look at potentially what we could do at scale. So we've started having those conversations as well. We're also linking into the Hampshire County Council wide sort of equivalent forum to recovery. Is it Welfare and Recovery Forum, I think it's called. So yes, we have started to have those conversations about what each area is doing and how we can potentially upscale it as well.
Philip.
Thank you, Chair. No, it's to pick up on the MHCLG's Changing Futures expression of interest and the fact that we were unsuccessful. Because I think it's a really exciting initiative, and as Sharon alluded to, I think there's still a willingness without the financial backing, but nonetheless for people to operate in partnership across the whole piece. What I haven't seen yet is a formal feedback on why we were judged to be unsuccessful, but there was a suggestion that was partly because the whole of Hampshire geographically is actually split into different parts, and to my mind it builds on what we were talking about earlier with the ICS and some of the concerns there. When the government looks down, if they're seeing an unconnected, be it local authority structure or NHS structure, then it's harder to convince them that we really are in the business of joining up and having complete across the way partnerships covering everything. And I've just got a funny feeling that we're potentially designing in a weakness across Hampshire if we have separate ICSs, if we have the different local authorities. There's no immediate answer. And I'm not saying big is beautiful necessarily, small is wonderful too, but I think we need to work really hard to having a single voice, and it just echoes very much to my mind the discussions we had on the previous item. That was all. Thank you.
Thank you, Philip. Any other questions? I can't see any hands raised.
I see Dr.
Judith. Judith.
Yes, thank you. I'd just like to explore something that's not really in the paper. Throughout the paper, it talks about the importance of good quality homes, access to green space, space outside and environment. But, you know, I really think we also should be looking, or maybe not us, but as a society, looking at the build specifications of homes. We know that during the pandemic, where there's been high indoor density of living, people have been more susceptible to the virus. We are moving, I think, towards a society that works more from home. So I think we need to take that into account, or the developers need to take that into account when building homes. I've seen bedrooms that are so small that they can't have a door on them because you wouldn't be able to open it inwards or outwards. I've seen homes where kitchens are so small, the most exciting food preparation you might extend to is beans on toast or heating something up in a microwave. And yet we want people to eat healthily and do more home food preparation. I think some countries, possibly Germany, but I'm speaking from memory here, do have minimum specifications for rooms. I don't know whether we do. If we do, have we got them right? But I think that this is an important factor that needs to be considered if we want people to have good health and well-being. It's not just the external environment. Thank you.
Thank you, Judith. What I would say is, when I was visiting a sheltered housing complex, they'd built some new houses round it up in Aldershot, and every single house in their back garden had a home office as part. So you actually left your home to go to work, but your home, your office was at the bottom of the garden. And I thought that was absolutely brilliant. And maybe that's the way forward for people working from home. I don't know. It's a question of getting the developers to take on board everything we're saying, really.
I'm happy to answer this question if that's useful. So yeah, absolutely, completely agree with you. And that was quite a big part of the Healthy Homes needs assessment as well. And there was always the intention to have another workshop to really focus on that element of the needs assessment and bring forward the recommendations. So that was planned for just after the COVID pandemic hit us, so we couldn't all get everyone in the room. So that is still something that we want to do and bring together lots of partners to see how we could improve the built structure of our housing. And also just to say that as a public health team, we contribute to new development consultations, and that's absolutely something that we look at with the building applications to see how we can improve the indoor space too. So there's pockets of it happening, but of course there's much more we could do as well.
Thank you.
Thank you. Rory, did you want to come in?
Thank you, Chairman. Yeah, just to give feedback again, fabulous presentation, all really, really good and inspiring. And to reflect back again the synergies really to the Ros's initial presentation and how dependent NHS and health outcomes are on these wider determinants. The partnership bit of this ICS is utterly critical to us succeeding and taking Hampshire forward in the next decade. Absolutely critical. And just to draw out, and I know that the brilliant work that Sharon and Pat do around homelessness, we've had good conversations in the past around that, but that really that the presentation brought out the breadth of what good home can do for health. If you think about 8,000 deaths, excess winter deaths due to cold in 1819, some of our most vulnerable, frail individuals vulnerable to deaths from cold. But by improving homes so they are warmer, you also make them more sustainable, and that fits utterly with our recognition of the climate emergency. So this is a really integral thing I think we could all really get behind for health and well-being. So really brilliant presentation. Thank you.
Thank you, Rory. Christine, did you want to, was that a new hand now, Christine?
Yes, it was a new hand. Thank you. Sorry about before. First of all, I just wanted to say it's a very good presentation and how pleased I am to see the Health and Wellbeing Board taking on board all the other things that influence health, as well as the things we're directly responsible for or involved with. Picking up on the conversation about the future design of homes and what the local authority can and can't do, and requiring developers to do things about size and layout and transport and all the rest of it. Of course, colleagues from local government districts will be very well aware that this is something that falls within the local plan. And some of the things that you can put in the local plan are defined by government, but on the whole, there's quite a lot of local possibilities as well. And it's quite likely that people are going to need to be refreshing, districts are going to need to be refreshing their local plan fairly soon, because the government is talking about changing the framework in terms of things like numbers of new housing and what it's possible for a local authority to require of developers. I'm therefore thinking that it would be really useful, I would suggest, if in some way the Health and Wellbeing Board could set out something fairly short that just talks about the sorts of things that it would be good if they could be included in local plans in order to future-proof future housing and transport and developments from the health point of view.
Thank you, Christine. I've just seen a note from SD.
Sean.
Sorry, Sean. Do you want to come in and answer that, Sean? I've just seen what you put in the chat line.
Yes, sorry, I was just to note that there are building for life standards by the Design Council, so there is a sort of standard that's been set out for a healthy home that can be considered in this kind of conversation rather than sort of reinventing the wheel, as it were. So just to note that.
Can I please just come back to that briefly? certainly we shouldn't reinvent the wheel, but the fact that it's in a book by the Design Council is, I think, rather different from the Health and Wellbeing Board collectively saying to districts, please, when you're thinking about the local plan, think of the health aspects, and these are the sorts of things we're thinking of. And certainly lots of the sorts of things we're thinking of could be things out of the Design Council's book.
Thank you, Christine. I'm going to actually move on to Councillor Patricia Stallard now. Patricia, I can't see you, but I know you put your hand up.
Oh, I'm here. I can assure you I'm here. I really want to recap on a few things that people have said. I do agree with Rory when he said this was an excellent presentation. So my thanks to all those who gave this presentation this morning. It was very interesting and I thought very thought-provoking. I'd like to follow up on comments made by Councillor Krasinski and also Abby about, especially Abby's remarks about the need for a housing workshop. I think that would be exceedingly useful and exceedingly helpful. And I'm speaking today from the perspective of having the portfolio responsibility for children's services and young people. And with that in mind, we know that young people are being, dare I say, locked up in modern flats and modern accommodation, modern houses, which are generally speaking far too small for a family to live in comfortably. And we know that at the end of the lockdown periods, we get a surge, and quite a significant surge in one instance, of safeguarding issues with quite horrendous situations being presented to us. So clearly, one of my roles is to try to do everything that I possibly can to protect the safety and well-being of all our children and young people. So my message today is, yes, I would like to see a workshop on this, but yes, I want to see more districts and more planners involved. It isn't always down to developers. Yes, it is partly down to developers, but we've got to get the planners and the districts involved. And as Christine Holloway has said, many local authorities are now refreshing their local plans. So we really need to have a very loud voice, a loud say on those plans, so that when homes are built, they are, dare I say, fit for purpose. The specifications may be laid down in the design board, as Sean has just said, but I think as someone else has already pointed out, that doesn't necessarily mean that they get transferred into reality. And that is the truth of the situation. They are not being transferred into reality. And I speak not only as the cabinet member, as I said, for children's services, but also as previously a long-serving city councillor, where I was quite heavily involved in the planning side of things. It is an ongoing battle, but I think collectively, as a group, we should be able to make our mark and make our voices heard. But we do have to involve the planners, we do have to involve the housing people, and we do have to involve the district councils. Thank you for listening.
Thank you, Councillor Stallard. I'm sure nobody would disagree with you, so thank you. Except perhaps Patricia, who wants to come in now. Patricia Hughes.
No, I was actually going to offer an opportunity to help Councillor Stannard actually land that, really, because obviously I'm here as the District Chief Executive's representative, so I obviously can take that back to the Chief Exec's group. But actually, I think we can go a step further, and we may be able to get the Health and Wellbeing Board to make a recommendation to the respective districts and boroughs that they look to put design codes into the next iteration of their local plans, which actually cover that design for life. So actually a recommendation from this board, because we all know that there are pressures in a local plan and they are trying to deliver lots and lots of different things. And it doesn't take away from the necessity to make sure we're providing good quality homes, but there are lots of other pressures in there as well. So actually a recommendation from the Hampshire Health and Wellbeing Board back to the districts and boroughs that actually put design codes or build that design for life into their next iteration, because everybody has to review it every 5 years. Everybody's slightly different place in that cycle because we all do it at slightly different times, but actually putting something out there might be a mechanism by which we can help the Health and Wellbeing Board actually direct or encourage individual districts and boroughs to actually include that within their next local plan. Thank you, Joan.
Thank you, Patricia. I think the words should be direct, not compel or order or that. We need to bring people along with us and convince them of the cause. Would everyone be happy for the Health and Wellbeing Board to do that to the districts?
Most certainly, yes.
Right.
Yes.
Super. Thank you.
Very good idea. Thank you, Tricia.
Right. Well, what I'd like to do now is I'd like to move us on in the interests of time and take you to the actions that we note the Healthy Homes project progress and endorse the planned next steps to develop and roll out a joint induction opportunity and multi-agency training, including educational videos. Note the good practice examples of work going on across Hampshire to develop healthier communities, along with the value of partnership working in this area to reduce health inequalities in Hampshire. Support the exploration of the Health Begins at Home Memorandum of Understanding, which would allow organisations to make a commitment towards the use of housing to improve the long-term health and well-being of communities, and to receive a status report on current disabled facilities grant practice at a future Health and Wellbeing Board. Is everyone happy? Oh, sorry, Samaya, are you going to conduct a vote on that?
Councillor Ferris, I just want to check, based on what Patricia said, do we want to add in something to the recommendations? Because if we do, I can add that in and everyone can review in the chat, and then that can be part of the approved recommendations. Do we want to add a few words in?
Yes, that would be a good idea. Yes. Shall we vote on the other ones first? Then we can come back to that.
Sure.
Yeah. Okay. So is everyone happy? And sorry, you're going to conduct a vote.
I think it's just going to be verbal, Councillor Fairhurst, and I'm just going to put in some wording for the last bit.
Okay. Can I ask if anyone disagrees with what's been the recommendations? Can I ask you to raise your hand now? I see no hands, so I'm going to take that we're all in agreement. And can I just say thank you to the presenters? That was a really good report and well worth your time and energy in coming to us. Thank you. We're going to go on to now the Local Transport Plan 4. And I'm going to hand over to Sian quite quickly because my dogs are making an awful noise in the background. So I'm going to mute myself and hand over to you, Sian.
Thank you very much, Councillor Stallard. David, would you be able to put the slides up, please?
Yeah, will do. Just doing that.
Thank you very much. So we're just waiting for the slides. So good morning, everybody. I'm Sian Davis, consultant in public health at Hampshire County Council, and we're working really closely with our transport colleagues in Hampshire County Council on the refresh of our local transport plan. And this is a really brilliant opportunity to incorporate health into a really significant plan for the County of Hampshire. So I'm going to talk for about a minute to you before I hand over to Frank Baxter, our Head of Integrated Transport Plan, who will go through the detail of the plan. I just wanted the board to note the wide-ranging impact that transport has on our health. We often think about transport as access, and that is very important. Now, that access also has an impact on the wider determinants of health. So that's our health services, for employment and education. But also I wanted people to really note that the impact of place as well. Transport provides, really shapes our local place. So if you look at the layout of the place where you live and you look at the relative spatial aspects of roads, green spaces, cycling and walking infrastructure, you can get a real feel for how that influences the behaviour of individual people and communities. We know that connectivity, good quality streets, mixed use streets encourage walking and cycling. Conversely, we know that transport can have negative impact on our communities, for example, through poor air quality, through noise, and also community severance. So the opposite of a good place, a poor quality place where people can't connect to their near neighbours, people can't access key community assets, and also places where people don't feel safe and comfortable walking and cycling. We know there's massive there's linkages between both physical and mental health with transport. And for example, we know that car users are less likely to be physically active. The other thing that the board should note is that transport does influence our communities differentially. Again, we do see inequalities, and often the negative impacts are felt most by disadvantaged groups. Finally, just to note that as our population gets older, and we are an ageing population, the ability to use a local environment becomes more and more key. So we need to make sure that our places and our transport works for our whole communities, including people as they get older, so they can remain physically active and socially connected. So I'm going to hand over to Frank now, and he will give you the details of the plan. Thank you.
Okay, thank you, Sian, and thank you, Chair. My name is Frank Baxter. I'm the Head of Integrated Transport. One of my responsibilities is to develop a transport strategy for Hampshire County Council and bring it to members for adoption in due course. That's what we're doing at this moment in time. And it is a statutory plan, which means that it forms a key part of the policy framework of the County Council. We are currently in an engagement stage, which means we haven't made any decisions about what we want to do. We want to listen to what people want us to do. So we're in an engaging stage, and we hope to move towards a consultation stage and develop a new transport plan and have it adopted by the end of the year. However, it's to note that for this board that this is the time to influence and shape before we put our pen to paper. So if you could move to the next slide, please. So this is some drivers of change, as we call them. These are the reasons why we're developing a new transport plan at this moment in time. There's a lot going on in terms of climate change, changing environment, protecting habitats, air pollution caused by transport. Also lots going on changing society with aging population and all sorts of things along those lines, plus a very challenging economic situation which we're likely to face as a result as we come out of the COVID challenge. Furthermore, we are in a transformational period of time where technology is rapidly changing around us and giving us opportunities that perhaps we've never had in the past. For example, broadband enabling home working as it does at the moment. So if you can move to the next slide, I'll try and bring this to life by sharing some of the kind of big issues and problems that I'm having to grapple with, and that essentially I'd like your help and advice on how we actually do so. So I'm going to put some of the big issues out on the table here. So Department for Transport tells us that traffic on Hampshire's roads is set to grow anywhere between 17 to 51% by 2050. And those forecasts are based on various different traffic models at a national level. We know that car ownership in Hampshire is also above average, with 45% of households having 2 or more cars or vans. Which is some of the highest levels of car ownership in the country. We know that surface transport accounts for 37% of all CO2 emissions in Hampshire. It's also the most stubborn to make a difference to. Of all of the carbon emissions from all of the sectors, transport is the one that seems to move the slowest, simply because we're still, largely speaking, in a carbon intensive transport system. If we can move to the next stage, please. Next slide. Other issues that we're having to tackle is that even if we convert all of our vehicles, all of our private vehicles to an electric fuel technology, we still won't achieve the carbon neutrality targets that we've set in our 2050 vision. That is simply because there is still a lot of carbon produced in electric vehicle production and use. It means that, therefore, in order to achieve carbon neutrality, you need to do more than simply going electric. There are also negative costs to society of the transport system. The emissions that are emitted by vehicles on Hampshire's roads account for a significant premature death due to air pollution, respiratory illnesses and so forth. And there are some shocking figures there in the presentation which highlight some work which has been done to do some primary research to understand what that might actually be for Hampshire. We also have an ageing net population and inward migration, which means that the population of Hampshire is ageing. We also have a population that is undertaking less physical activity than it used to. And we now know that 90% of adults in Hampshire undertake less than the 13 minutes of physical exercise per week, and only 32% of boys and 24% of girls aged between 5 and 15 do sufficient physical activity. We have some good positive stuff that we can also build on. Bus use in Hampshire is increasing despite there being a national decline in bus use. The pandemic has changed things at the moment. We hope this is a blip and we'll return to the same trends as before in due course. Another trend is that the running of public transport is becoming more expensive for users. The actual net cost of choosing between one mode or another is still making the car the more attractive mode to use financially. This is a list of outcomes that we're looking to deliver through the local transport plan. Through the engagement, we're asking people to tell us if they agree with these outcomes. There's a lot in there that's taken from existing planning policy and documents, notably the 2050 vision. So a lot of it will be familiar to members of the board. I won't go into them in detail, but they're there for members to make comment on and tell us if you think they should be changed in any way. So if you move to the next slide. This is the engine of the LTP that we're consulting on, engaging on. Sorry, the engagement will include things like a vision, the drivers of change, the outcomes. It also seeks to take a litmus paper, or a test, if you like, of the types of measures we could consider without actually saying we will do this. It's seeking to see whether there is support, whether there is what kind of issues would apply if those measures were to be implemented. But for me, the main part of responding to the LTP would be to tell us what you think about these two design principles. The design principles, for me, mark a change in the way that Hampshire could potentially manage its transport system and try to influence transport in Hampshire. As you can see here, the wording for for these is to significantly reduce dependency on the private car and reduce the overall need to travel. And the second is to create a transport system that supports high quality, prosperous places and puts people first. I'm going to try and just give you a brief explanation now in the next two slides of what that might mean in practice, should those be the design principles that, following the engagement, are the ones which rise to the top or are supported. So guiding principle 1 is primarily about the reducing dependency on the private car and reducing the overall need to travel. This could be read as being anti-car. It is not. The car has brought significant freedoms. It is a particularly important mode in rural areas. But what we're seeking to do here is to actually widen choice of other modes. So this principle is really looking at trying to make walking, cycling and public transport much better quality than they are at present. It's looking to take advantage of the trends that we're seeing in society at this moment through home working, to live local, to travel less. It's looking to see how we could own fewer cars and use them less. Technology gives us new ways of vehicle ownership, which may mean that we might have one family vehicle that we own, but if we need other vehicles, we can rent them. And that's known to actually improve and reduce the number of miles driven, but also support active modes at the same time. So that's the general principle in terms of reducing dependency on the private car and the overall need to travel. If we could move to guiding principle 2. Guiding principle 2 is about creating a system that supports high quality, prosperous places and puts people first. This kind of harks back to a lot of the conversation that's actually been had already so far at the board about the integration of land use and transport planning. And I can give a few examples of what this might mean. It might mean that actually when we're designing our high streets, we're making them better for people to walk to, cycle to, through and feel like they're in a much safer, more pleasant environment. Public realm improvements similar to those that we've made in Romsey in recent years, for example. It also means that in developing master plans for new developments, we would look to integrate bus use into those developments better than we perhaps have done in the past. There are still streets that buses cannot get into, which stop them doing so, and it's fairly simple to actually put in place the planning policies that allow us to do so. We would also be looking at things like 20-minute neighbourhoods within master plans and new developments, which allow residents of new developments to be able to access a range of services within 20 minutes by walking and cycling. and also concepts like low traffic neighbourhoods, where those streets are designed so that they encourage walking, cycling, and also building on ideas and concepts like school streets, where we're looking at times to restrict traffic during school opening and closing times in order to create more pleasant environments for children to be dropped off and picked up from school. Moving on, David. So this is basically just a general diagram showing where we're at the moment and where we're going to in terms of the development of the LTP4. We've done an awful lot of evidence-based collection, of which many of those sources are coming from public health and include the Hampshire Physical Activity Strategy, the 2050 Vision, the Joint Strategic Needs Assessment, and various forms of evidence from Public Health England. We're at the stage at the moment on the diagram which is ringed in red, which shows that we're actually looking to set the vision, the outcomes and the guiding principles, and we're hoping very soon to move to the stage where we can start to actively write the LTP4 document and take it forward for consultation. Next slide, please, David. This is how you can get involved. Effectively, there is a live consultation on a microsite, which all the links are here on the presentation. The closing date is technically shut, but we've left it open so that if any members of the board do wish to make representations, they still can, and they will still influence the development of the local transport plan. So I'd encourage you all to take part if you can, and that is the end of my presentation.
Thank you, Frank, and thank you, Sian. Questions, please, members. Patricia Hughes.
Thank you very much, Chairman, and my apologies for diving in there. Firstly, to say thank you very much, Frank, for a great presentation. Really enjoyed that. Got the juices going in terms of the thought processes. I suppose a couple of questions for you or seek clarification. Firstly, I suppose that one question is, have we ascertained the rationale for people to travel in the first place? There may be some key ones to schools, to work, to shopping, and I just wondered on that basis, when we talked about trying to reduce the need to travel in the first place, around the employment piece, whether we're actually having those conversations in the economic development sector around employment policies. So I happen to know that one of the district authorities actually used to, and I don't know if they still do, actually had a policy which they would not employ somebody who lived beyond 20 miles from their authority to try to reduce the amount of carbon emissions associated with employment. And I just wondered whether we were starting to think about those sorts of conversations and then possibly the next steps which we might come through. And just one other thing was also around rail is obviously quite a key aspect or part of the transport network. And I just wondered if you could comment on how we're bringing that in, because I know there's been some capacity issues in our major infrastructure rail system. Thank you.
Frank, do you want to answer that?
I think certainly I can, Chair. The issue around planning, I think, and the integration and the employment piece, I think, is an item that it could be and would be a very useful item to bring to the Hampshire and Isle of Wight Planning Officers Group. And I think those issues that you've raised would be very well would make a very good agenda item. In terms of rail, the impact of the pandemic has seen a vast and significant drop in rail patronage. How it recovers and what it recovers to is still unknown. I think there will be significant changes. I think the change in working practices is likely to have a significant impact on how the rail system works in the future. It has in the past been largely based around providing season tickets to people who want to go and work in London, and that's certainly been the main driver of how the network operates. I think that may change as we move towards more part-time working, and I think you could see a change in the nature of the way the whole rail system works.
Thank you, Frank. Philip, do you want to come in?
Thank you, Chair. Very interesting presentation, and certainly at a strategic level, something that I think we all can only support. Where I do have a couple of concerns, however, is the actual effect on the population I think has a real potential to be uneven. You know, the incentives that are put into the system and disincentives, I fear may end up conspiring against those who are already more disadvantaged than those who have the wherewithal to deal with any increase in price or whatever. There are many positives to private car use. For a lot of older people or less able people, they provide a degree of independence and mobility that's not so easily replicated by simply being slightly more active. It doesn't always work. I mean, if you want compost for your garden, and you're 80 years old, the bike's unlikely to be the most obvious way to do it. And there's nothing in the papers that have been presented today that does recognise that there are some real positives. One of the reasons there are so many cars on the road is many people find the cars a very useful part of their lifestyle. Now, if you're going to try and affect change on people that's as big as this, and these timescales are remarkably short, then I think we need to give some kind of public recognition to the current benefits and then argue from that point why the changes are desired. I mean, Frank was just saying about we don't know post-pandemic what the public transport uptake is going to be for trains or whatever. Right now, there's a lot of people, I have many friends in London, who simply won't get onto the tube and they don't see their head getting around that space again, and it's very hard to predict. We saw the natural response in London to the COVID pandemic and local transport changes that were made. Some of them worked brilliantly, but quite a large number of them actually were completely unacceptable to the local populace when it ended up forcing traffic elsewhere. So what I'm saying is I know we're going for net zero, but we've got to try and make this a zero-sum game as well, that the benefits to the population are also in their practical day-to-day life. So I think for me, the way to achieve that is by giving some recognition currently of really why people have cars and use them so ubiquitously, and then how we're going to encourage and support them, and not just penalising to move away from that. So I get back to support it overall, but we've got to take the people with us on this, and I'm not sure we're doing that at this stage. Thank you.
I think you're right, Philip, about taking people with you. People will not give up their cars easily or willingly. They're used to it. They expect it. It'll be a hard act to get people to give up their cars, unless we start with the younger generation and don't let them have cars in the first place, so they don't get used to it. Sorry, I'm being. Patricia, Councillor Stallard.
Thank you, Chairman. Like the previous speaker, I absolutely and totally support what we are setting out to do, but I do have one or two things I'd like to raise with you, Frank. I like the idea that the proposal is in future we will be planning for people and not cars, and you talk about, in your discussion this morning, you talked about urban centres and residential areas, and you encouraging people to live locally and travel less. But what I'd like to know is what accommodation will be made for those people who live and work in our rural areas, because Hampshire is 80% rural and 20% urban, so the bias is on the rural side. Now, many of those people don't necessarily choose to live there. It's because maybe they're smallholders or farmers or forestry workers or what have you. Those villages currently don't have shops, they don't have a post office, they don't have a doctor's surgery, and they don't have a bus service. So those people are compelled to use cars or taxis or something. And I just wondered, it's not a criticism, I just wonder what compensation might be made in any planning so that those people are not going to be disadvantaged because of where they have to live.
Thank you, Councillor. Do you wish me to answer that, Chair?
Yes, please, Frank.
So as part of the local transport plan, we're actually developing a range of topic papers, one of which is completely focused on rural issues and how actually transport in rural areas will be addressed. So the issues you've raised are fully recognised, the dependence on the car and the need for the car are something that we would need to factor into whatever we do, and the solutions that come out of that, the rural transport paper, be it taking services to rural areas, or actually avoiding the need to travel by taking, you know, fibre spine networks into rural areas in order to improve Wi-Fi capability so that home working in rural areas can be much better. I myself today have had to ask David to share the presentation because the Wi-Fi where I live in a rural area simply isn't strong enough. So those are the sorts of things that we could be looking at.
Thank you. Christine.
Sorry, I'm just waiting for my camera to sort itself out. I wanted to say, first of all, I'm completely delighted that we've got this paper because it's a really solid example of trying to make the link between the health concerns and the other concerns. And I would really commend the summary, the executive summary at the very beginning of the report, which talks about why the connections are so important. I haven't seen a complex topic summarized so clearly and briefly. I thought it was really good. And I would like to say that our discussion within this board about the paper and the possibilities, we ought to be focusing on the implications for health rather than responding to it as people who drive or don't drive. And so in that, and so I've got a sort of variety of separate individual points to make on that side. The main one is that it is really difficult, I think, to try and get the balance between reducing cars, which we have to do for all the health reasons set out so clearly, and trying to work out the way to do it in such a way that you don't disadvantage people and, as Philip Raphael said, take people with you. Liz referred to start with the younger generation. Actually, before lockdown, so before there was an issue about jobs and money, the younger generation are not buying cars at the same rate as other people because they do understand it's just not something that you're particularly interested in. The arguments about access for older people being able to get in from rural areas, older people needing to have a car to carry the compost in, they're all absolutely right. But we can't use those as a Trojan horse for saying we don't want change. We just have to make sure that the changes actually make things better. For example, if your towns aren't full of cars parked by people who've driven in when they didn't need to, there'll be more space for parking for disabled people or older people who need to get about. If the roads are clearer and people's health is better because of less air pollution and more exercise, then it's not a problem if somebody who lives in a small village has to drive to the closest town to do the shopping, or of course people have to drive. It's a question of reducing the unnecessary car journeys, and that means a combination, I think, of stick and carrot. We can't do it only by getting people on board. We have to do it. I mean, we get people on board to a certain extent by improving buses, by making changes, but we also have to do things that tilt the balance so that an individual who has the choice chooses not to drive because they think it's better. One very small thing I wanted to say about rail, it would be good if we could think a bit more about rail. It would be good if the county council's transport could think a bit more about rail. In other parts of the country, local authorities, transport authorities have lobbied to have either more stops at local stations or even to develop local stations. And I think that isn't something that Hampshire's looked at, and it might be worth considering. For example, an awful lot of people commute up and down the commute from South Hampshire to jobs in Winchester and Basingstoke. Might be worth thinking about whether more of them could be encouraged to do it by train if there were more trains that stopped. Thank you very much, everybody.
Thank you, Christine. Sean, do you want to come in?
Thank you, Councillor Fairhurst. to go back to Councillor Raphael's point about inequality and ensuring the most disadvantaged are further disadvantaged. So I think the transport team are really, really cognizant of the fact that we've got inequalities in health, and we will make sure that we do not do anything to exacerbate any inequalities. Hopefully, actually, this might have the opposite effect. And also, just a quick note about journeys. Unfortunately, I was trying to sneakily look, but I can't do that looking enormously rude to the board. There is a significant number of journeys which are less than 1.2 miles made in Hampshire. So I think, whilst we can always look at we've got to do this, we've got to do that, there is scope to change, even though start with those smaller journeys. And if we make those journeys attractive, they are also then opportunities to increase physical activity in our daily activities. So I think there are some win-wins here. It's not all negative, but obviously this is a challenging conversation.
Thank you, Sean. Before I take you to the recommendations, Councillor Perry, did I see in the chat that you said that Hampshire County Council had funded the Chandler's Ford railway station?
Yes, I believe that is the case. We have done something about railway stations. You can only put railway stations on railway lines, can't you?
Yes, that's very true. Thank you. Board members, can I take you to the recommendations, please?
Councillor Fairhurst, I'm sorry. Alex has her hand up.
Oh, Alex, sorry.
Sorry, Councillor Fairhurst, thank you. I just wanted to sort of very briefly, I had one question, one point. So the point is that the UK is, Simon and Sian will tell me if I'm wrong, I think about the most sedentary country in the entire world. So, you know, we are not sorting this at the moment. And I absolutely love the idea of encouraging, making it easier for people to lead more active lives. And from a health perspective, that is all a positive. So, you know, I think we are at the extreme end of people getting in their cars and sitting on their bottoms all day. And I'm probably a bad example myself. So I just, you know, I absolutely support this, encouraging, putting a positive slant on getting people out and about and moving around. My question was, how is this linked into, so Basingstoke and Deane, I know, have got thoughts about mass transit systems. From our perspective, it would be brilliant if that was broader than just Basingstoke and Deane and was a bit, you know, from a public transport setup. And I know Southampton City have recently gone out to consultation on their transport policy. And I just wanted to, I'm sure it is all joined up, but check that it is all joined up with other transport things going on. Thank you.
Thank you, Alex. Frank, are you joining up with the other districts, with the districts and the other the unitaries?
Yes, we are. It's a very topical issue. In fact, I mean, yesterday was then a national announcement about Bus Back Better, which came out from the government, actually setting out a new strategy for how to you know, recover the bus sector, but also then get it to thrive and strive. And that's sort of taking the concept that Alex is familiar with about the mass rapid transit proposals around Basingstoke and rolling them out to other urban areas in Hampshire as well, with the aim of speeding up buses, making them easier, cheaper to use, and also making sure that we can reduce the emissions coming from public transport as well. So there's quite a big positive story there, and we are working very strategically both at sub-regional and regional levels with organisations like Solent Transport and Transport for the South East to actually try and maximise that join up across authorities and across boundaries.
Thank you, Frank. Barbara.
So just building on Alex's point around inactivity, we're also a nation where we have a huge problem with obesity, and therefore we do need to think about diet and exercise, and the health aspects of this have been brought out in the plan. But one of the things that has happened through COVID, where we've actually only really been allowed to move locally, is that footpaths have been completely trampled down, and parking spaces in favourite places on the outskirts of our communities have been completely overburdened, not helped of course by the wet and muddy weather that we've had. But I just wonder whether or not that's the province of district councils and is something that we ought to push, that actually in order to encourage activity and walking, we do need to find sensible amounts of spaces for us to walk in, and places where we can safely be, to park, to actually get to that place to walk.
Thank you, Barbara. Councillor Perry.
Sorry, I'll be brief, and I think Barbara made a fair point there, but I've certainly done a bit more walking during lockdown, and one of the side benefits of that is I spot the litter that's been pushed out on the road, and so I can pick it up, which is something you can't do when you're driving along. But I was just going to raise an idea that I guess county highways haven't thought of, but at a meeting of CPMR, the Conference of Peripheral Maritime Regions in Europe, I visited the town of Bayonne in southern France, and there they had a wonderful system of electric buses that drove around the town. Anybody who went to the town parked their car in the park and ride on the edge of the town, and the electric buses were free to use. You paid to park your car, but you could get on and off the buses at any time, anywhere in that town. It struck me as a wonderful scheme. I've not seen it repeated anywhere else, but and I don't know what the economics of it were for Bayonne, but I think it would be a good experiment for a town like Basingstoke or somewhere like that to adopt. I just leave the thought.
Thank you, Roy. Frank.
I think the thought is inspiring, and I love the vision. I think it's exactly the sort of direction that we need to be going in. We've got sort of halfway there with Winchester. Making the buses free is the next step, I think, and electric. But we may be able to get there in due course in the future.
Thank you. Rory, do you want to ask the last question?
Thank you, Chairman. Just a couple of connections with the work we're doing in the ICS, and I know we have the links with Sian and Simon, and we're looking forward to continue to develop and build on those. The Prevention and Inequalities Board of the ICS, which Alex co-chairs with Simon, Alex will know, has recently ratified a refresh of the plan, which centralises and gives more prominence to physical activity and supporting Energise Me to take forward the Hampshire and Isle of Wight physical activity strategy. Within that, obviously, physical active transport is central, and these plans, I think, will support that. We've talked at meetings here before. I know Christine and Matt Nisbet before also highlighting the sheer value of the structural determinants that allow you to be physically active and undertake active transport, which again, the NHS perhaps not within their gift, but very much in our wider partnership working gift to address. Two, we've talked about I think Councillor Gretzky really well put the point earlier about home working. The NHS has shifted massively throughout COVID to doing remote appointments. They're not clearly the only way to do medicine, but they are providing increasing opportunities around access and taking cars off the road. So perhaps shared learning there. And as the ICS looks to do its own green strategy as its commitment to the long-term plan, I think we can have shared learning and keep these connections going. Huge investment coming in terms of hospital infrastructure into Mid and North Hampshire, as Alex will know, in the form of new hospitals perhaps, and how this transport plan links in with them and how their understanding and assessment of travel links will be key. And finally, just 2 words, climate and emergency, and we had the bravery to declare it as a council in 2019, and I think hopefully the aspirations of this plan will continue to take us down that journey to really deal with it. So well done again, everyone. Thank you.
Thank you, Rory. If I could take everyone to note the progress by which the local transport plan is being developed and the opportunity for board members to influence its future direction, and for board members who have not already done so to consider responding to the local plan engagement. Is everyone happy with that? I am going to call a quick break now, but before I do, going back to the previous subject and the board's desire to place a recommendation before the districts, can I just read you out what we've suggested, and if everyone's in agreement, we'll add that to the recommendations. The Hampshire Health and Wellbeing Board requests that all planning authorities review their local plans with particular regard to the Design Council's current standards and the current and
Sorry, Councillor Fairhurst, I think that was the previous one, I think with particular regard to current and emerging design standards for healthy homes.
Thank you, Samaya. To current and emerging standards for healthy homes. If anyone's against, hand up, or anyone abstaining, hands up. If not, we will add that to the recommendations. Okay, what I'd like to do now is call a 10-minute break, So everyone can stand up, move around, get a cup of coffee, and we'll be back in 10 minutes. Samaya, if you could stop the public broadcast now, and we'll come back at, it'll be 11:45, will it? Yes, 11:45.
And we're live.
Thank you. All right, welcome back everyone. We come to item 8 on the agenda, which is the Health and Wellbeing Board Annual Report. We have various presenters. I'm going to ask Graham to introduce, and I'm going to ask each of the board sponsors to contribute as we go through. So Graham, can I pass over to you?
Yes, indeed. Thank you, Councillor Fairhurst. Board members will find the annual update report in their packs at pages 79 to 100. As is described in the report, the key focus over the last year has been upon inequalities affecting our residents, largely as a result of COVID-19, but also pre-existing factors. I'd like to invite each of the theme sponsors to provide a brief overview of their respective section of the report. With the permission of the chair, I would ask that board members hold questions until the end of the annual report update. So firstly, I'd like to invite Simon Bryant to give an update in terms of strategic leadership. Simon.
Many thanks, Graham. Many thanks, Chair. So with the strategic leadership section, it's just we've done a lot of work thinking about how we take forward the board in the last year, thinking that we've done a board survey and a number of items there. So key developments there, we have obviously had virtual meetings, which has actually enabled a good discussion and good attendance, which has been really positive. Our joint strategic needs assessment, which is that underlying document really driving forward our work, has been paused, but we are picking that up again and we'll have the census being completed, I think, this weekend. So we'll get some new information there. There's been a lot of work around inequalities, not least highlighted by the COVID pandemic, and we are picking some of that up through various boards to make sure that the work of inequalities is threaded through all of our work. And then we've linked on climate change to work within the county council, but also across the partnership to further kind of take that forward. We know climate change and health will have a big impact. And then I know you've talked a lot about planning and local developments, a key area of work for us if we're going to influence the health of our population in terms of planning and place. So those are the key areas we've taken strategic leadership.
Great, thank you, Simon. Our next section is Starting Well, which is led by Steve Crocker, but this morning Suzanne Smith will provide an overview. Suzanne.
Thanks, Graham. So just briefly, we did an update to the board several months ago that covered the progress so far in some detail, but just to summarise that there's significant investment and activity around children's mental health going on across the system, and some really close working now between the Children's Services Department and the CCG around those children eligible for continuing care. The COVID impact is, as you would expect, and as we're all kind of well versed in, the impact of children not being at school and the pressures on families as a result of lockdown. The effects of that will be seen for some time, but across all agencies, there's significant work going on to put in place interventions to support those families and those young people. Just in terms of significant next steps, we have a joint commissioning strategy now in place for the first time between Children's Services and the CCGs, and we'll be delivering on that. And we're also doing some targeted work around the domestic abuse pathway, what that feels like, what that looks like for families, individuals and professionals involved, and also looking at the parenting pathway across the county. So those are our priority actions next. Thanks, Graham.
Great, thank you, Suzanne. If we could then move on to Living Well and Dr. Barbara Rushton. Barbara.
Thank you, Graham. So key issues and developments really for Living Well as a result, as you've heard several times already, with the last year and during the COVID pandemic. It's actually highlighted the inequalities across our population. So although health and care services remained open for the majority of things, a lot of this has not been face-to-face, and so there has been impact on not being able to, for differential impact for people on not being able to access care. There's been some particularly good work that's been focused together across the health and well-being around shielding, and particularly, as you heard earlier, around the homeless. And I'm really pleased to hear that has actually encouraged more of our homeless to be able to register and to receive care. So there's lots of good examples of agencies working together. And we will, of course, need to focus on mental health throughout the year. So looking at some of our programmes, we found it quite difficult to continue with things like our smoking programme during pregnancy, because some of the tests have just been impossible to do without being able to see people face to face. However, we've had a really successful programme, Quit for COVID, where people have committed to reducing smoking and in fact to ceasing smoking, which will be good for the health and well-being of themselves and our populations. And we've heard that actually there will be 100 million now that's going to be invested in weight management services, so that we can decide how best to use that in the future to boost our campaign on obesity. There has been a huge increase in self-harm and domestic abuse, and of course poor mental health and well-being through isolation, and we must make progress on that. So just really to conclude, I think the important things for us now are to concentrate on the underserved population and to make progress on actually how to progress offering health and care to those people, and to support them to uptake some of the things that are going to be available for them. There's a focus on digital tools and how we can actually work better together by using digital solutions. And as we heard earlier, as we move towards an ICS, we'll continue to work with communities to co-produce solutions that work for them alongside the voluntary sector. Thank you.
Barbara, thank you very much. I'll now cover the Ageing Well chapter within the strategy. So I'd like to begin by firstly acknowledging the unparalleled joint working across many organisations and all our communities across the county of Hampshire. But I'd like to particularly note the contributions of the voluntary and community sector organisations who, along with a range of statutory organisations, have absolutely been in the forefront of supporting residents throughout the collective response to COVID-19 in the last year. It's important to recognise the duration of our collective response, the 1 year anniversary of the first national lockdown being next Tuesday, the 23rd of March. Where's the last year gone? It's really important, I want to say that on Tuesday there is a national day of reflection in terms of what we've endured and those we've lost over the course of the last 12 months. And locally, we've been working very closely with Hampshire Care Association to ensure that we mark the occasion of the first anniversary. And please, I would urge all colleagues to observe the minute silence at 12 o'clock in terms of a personal moment of reflection, and indeed what collectively has needed to take place over the last 12 months. Colleagues will see in the report at paragraph 69 to 73 some of the examples of the work that's been undertaken in support of older people, but of course it extends beyond older people alone. It's already been referenced by Barbara in terms of things like the welfare helpline, which has been available to support those residents shielding and also vulnerable. Over the course of the last 12 months, more than 100,000 people, either through being clinically extremely vulnerable or vulnerable for other reasons, have been contacted and supported through that work. We've also heard this morning in terms of work being undertaken around the Healthy Homes Needs Assessment and the subsequent working group. Again, a key issue, as we've already picked up this morning, for our population, and in particular, I would add, for those older people. I'm sure Councillor Crampton will speak upon this further in her update in a little while. Technology, it's increased the more focused use in the way in which we've collectively supported residents is also a key feature of the last year. Continued use of technology, whilst ensuring that we leave no one behind, is sure to be a feature of our collective future working in support of residents and indeed our shared ambitions. There's some really fantastic examples in terms of critical work taking place across the county and across our communities, where technology has made attendance possible in a way that hitherto we've not seen. So we need to reflect, we need to learn lessons, we need to bring the good forward with us, and we need to change the things that haven't worked as well. Board members will see at paragraphs 74 to 76 a range of collaborative approaches to supporting care for older people following admission to acute hospital settings. However, as we've heard many times through the course of the meeting this morning already, the importance of home and local place has meant a comprehensive network of support has continued to be put in place and supported alongside pre-existing community assets. For example, we've now got a Carers Bronze Group, which is led by Carers Together, supporting people right the way across the county of Hampshire, and also the extended community of support to keep people safe and as independent as possible through Wellbeing and other support via the faith community, such as the Good Neighbours scheme, and the voluntary community sector partners and others in supporting marginalised communities through a range of support, such as the local response centres, food banks, and so on and so forth. And of course, we also need to look at the really quite phenomenal progress nationally and locally in terms of the vaccination programme, with particular focus upon our most vulnerable residents, certainly through the early stages. Finally, the coming period will be key as the county begins the transition out of lockdown. A range of services and support will need to be carefully restored, and there is much catching up to be achieved. Thank you. If I could now hand over to Dr. Peter Bibaway to cover the Dying Well chapter, please. Peter.
Thank you, Graham. Thank you, Chair. So just before I go into the detail of the Dying Well, I thought it was an interesting and quite timely conversation this morning about the Hampshire and Isle of Wight ICS, and I've been intentional in listing both the Hampshire and Isle of Wight as well as the Frimley ICS in this particular chapter, taking similarities, learning from across both ICSs, and actually it was quite a good exercise and an intervention in its own right to see the good work that's happening across both geographies. So just thought just kind of highlight that from the start. From the main highlights for key issues and developments, there's been in Hampshire and Isle of Wight ICS footprint end of life board established with key representation from acute community, hospices, commissioning teams, and wider communities, with 5 key strategic areas around direction, interoperability, training and education, early identification of patients and carers, as well as bereavement and care after death. From a Frimley perspective, there's Respect will be implemented in May. Hampshire and Isle of Wight have been far ahead in that. In terms of COVID impact and mitigations, just to highlight a few areas, the difficulties that some of the providers, particularly the hospices, have had over the year. There's been a great understanding of what they're going through, recognizing the significant contribution they play in the end-of-life pathway, and that message was reinforced by the Southeast and regional NHS E&I team. SCAS pathway in terms of ambulance, developing pathways for patients to be transferred to die at home. There's been the implementation of a single community syringe driver across Hampshire, Portsmouth, Southampton that were updated back in 2019 in response to Gosport. The other area to highlight around collaboration and co-production, there's been multiple ICS subgroups formed that look around education, staffing, and patient needs. Some of the subgroups have been on hold because of COVID. If I talk about the progress against metrics, yes, it's been on hold due to COVID, and rather than use but using the word and. The Hampshire and Isle of Wight developed the ethical framework, which is a great a framework that takes into account the fundamental principles such as everyone matters, the interest of each person or the concern of all of us and society, and the harm that might be suffered by every person does matter. Principles of respect, minimizing harm, fairness, working together and so on. And I think the local authorities and the clinicians across the ICS have been working really hard on developing that piece of work. Next priorities, some logistical ones, such as funding resources that would allow us to roll out things like ePACS, the digital platform, looking to do that in autumn of this year. And as I previously said, respect in the Frimley system. I think just ending on the health inequalities aspect of end of life, there's a new project around homelessness and end of life, which is great to see, particularly around quite a disadvantaged and a vulnerable group in our community. Thank you, Graham and Chair.
Peter, thank you very much indeed. And Healthier Communities, Councillor Crampton.
Yes, thank you. You've already heard quite a lot of what we've been doing from our presentation, but the last time we were able to physically meet was January 2020, when we had our Healthy Homes workshop. We were overwhelmed with people who wanted to come, and we were only limited by the size of the venue. But what the pandemic has shown us is that we're no longer limited in that way, and we've been doing quite a lot of a number of meetings on Teams and Zoom, some of which are down here in the report. And we've been involved in a good number of these recovery workshops, for example, and local forums. When we did our presentation, we talked about some examples of good practice, and those examples of good practice are being rolled out to the other districts and boroughs for them to take up. We've also been advocating health and well-being in all policies approach, which we've been talking to our districts and borough departments about, and they've been very interested in learning more, which is why we're doing quite a lot of these workshops with officers from the districts and boroughs in order to not only share good practice, but also put some new policy measures into place. On the COVID impact, we've had, as you've heard, about the homelessness strategy, which has been very successful, and you know, we have some wonderful people who have been working on that and have been helping us with that. And our local response centres are stepping up to the mark, and we're involving not only the local authorities, but also our voluntary sectors to support the vulnerable in the community. And from that, we have identified a good number of issues that have come out of that, not just physical well-being, but also mental well-being, and also with our theme of the wider determinants of health, financial hardships and the economy have come into it as well. And we're working together with our communities and other local partners to develop and promote initiatives that we can share throughout our organisation. And we've developed all this because of the number of partners we have in the districts and boroughs who are all very, very keen to share knowledge and to develop policies that we can share across the whole of our communities. As you know, what we're going on to do is to progress quite a lot of the healthy homes. The white paper on planning will be coming out shortly, which will contain a great deal of detail about design, and we've had a good deal of input into that already, but of course they will be changed and modified as the white paper progresses.
Thank you, Anne. So Councillor Fairhurst, that concludes the updates from board sponsors. I'm sure colleagues will be more than happy to take any questions or indeed any comment. Thank you.
Thank you. Before I open it for comment, can I just say thank you to all the sponsors for all the work they're putting into each of their respective parts. I think the progress the board has made, it has been really positive and good from where we were a short while ago. So thank you all very, very much. I'll throw it open for questions or comments now. Christine.
Thank you. I wanted to bring the board up to date on one other thing which wasn't covered in the section on strategic leadership. Back on the 24th of June 2020, when we didn't have a lead for strategic leadership because it was in the middle of changing, the board approved a paper on next steps on co-production, on embedding a culture of co-production, in which we agreed a variety of things, one of which was that whoever did take over responsibility for strategic leadership would have a main theme on co-production and would look at the best ways of embedding it. Now, it was a while before Simon was appointed, and inevitably he has of course been incredibly busy with COVID. So I just wanted to reassure the board that he and I are having a conversation about how to take this forward in the next few weeks. And perhaps we could make a note that we'll bring back a more detailed update on that section, which is missing out of this update, at our next meeting.
Thank you, Christine. Perhaps we could put that item into number 9, which is the forward plan for future meetings.
Lovely, thank you.
Okay. Any other comments or questions? No? Right, well, thank you all very much. Can we go to the action, which is that we note the update progress and priorities of the board's work. And actually, we actively share the report with constituent members, boards and committees to ensure further engagement and development of the plan for 21-22. Okay, Barbara, sorry. Barbara.
Sorry, Councillor Fairhurst, can I just intervene just before you do make the recommendations? Just to note, really, that it was very obvious from the report that Ros Hartley shared with us on the white paper around the future of the ICS, that the health and well-being, health inequalities are going to form a very major part of where the ICS must go, and the health and care partnership will be a very big part of delivering that, so that all that has been said about the wider determinants of health and actually seeking out and supporting people who are, even because of COVID, now more likely to have health inequalities, is going to be the province of this board. And the Health and Wellbeing Board itself will come into very much more prominence as part of the ICS, bearing in mind that there are different numbers of health and wellbeing boards in both of the ICSs into which Hampshire plays. So in Frimley there are other health and wellbeing boards, and across Hampshire and the Isle of Wight there are other health and wellbeing boards, and that will obviously be worked out when we do our deep dive around the white paper. We'll be able to take that further, but just really to point out that population health management, working with people, working with health inequalities, is absolutely part of where we will work together in our health and wellbeing partnership as part of the ICS. Thank you. Thank you, Barbara. Alex, you'd like to come in as well.
Yes, sorry, I just wanted to say, so the recommendation about sharing, I think is spot on, but I just wonder, without wanting to create another task, whether there's a more visually attractive way of presenting some of this information, because there's such richness in this, but I'm just conscious that if I send this off to, my senior leadership team, it feels a bit like it's another governance paper to read, and I don't know whether it's worth, given how amazing the data in there is and all the stuff that's going on, whether it's worth just getting a comms person to do a kind of easy read version or an infographic version or something that people might be more inclined to pick up and read.
Thank you, Alex. I'm going to turn that over to Graham, because actually I think that's a very good idea. Graham.
Yeah, so I would absolutely agree. The problem with it being a committee report is it looks like a committee report. So more than happy to take an action away that we look to ensure that the information contained within the report is presented in a more visually interesting and exciting way. Because I think you're right, Alex. It loses something because it's quite a rather stale-looking document when you just receive it through an email. So yes, we will absolutely look to do that work and share it across partners.
Right. Thank you, Graham. Right. If we go back to the actions or the recommendations. Is everyone happy with them? No dissent? Super, thank you. So if we move forward now to item 9, and we have already got something to put on it from Christine about co-production. Can I ask other members what they would like to see on the forward plan for our next meetings? Any suggestions from anyone? I know we're going to have an in-depth review on the ICS when possible. Barbara, you've got something else?
I'm just thinking really that we need to understand as a system how we are going to approach well, not really recovery, because I don't think recovery is a good word. What we really need to do, obviously, is to recover our position, but to embed all of the good things that have happened through COVID. So how we intend to work together, and really just to have a thumbnail sketch across our different chapters would be a very helpful way of understanding what we can do to support each other in actually delivering on health inequalities to our population.
Thank you, Barbara. Julie, welcome. You want to say? Julie, you're still muted.
Apologies, Chair. I turned on the video and didn't take off the mute button. Just to say that we next week have a workshop for the development of the next physical activity strategy. We've got over 200 people signed up to that workshop from all sorts of different sectors, which is amazing. And can I just comment on how many times people have mentioned being active, physical activity and so on this morning, and I've not had to say a word. So brilliant. Thank you very much, colleagues, for that. Yes, I think it will be, I'm not quite sure when we will have it written and whether it will fit in time for the next meeting or the meeting after, but I think it's going to be very relevant to bring that new strategy forward, because I think it will look very different from the existing strategy. And we'll definitely be picking up some of the recovery items and so on. So if I could just log that, that would be really helpful. Thank you.
Thank you, Julie. We'll look forward to hearing it. Simon.
Thank you, Alex. There's a couple of items that we just need to put on the forward plan. One is the joint strategic needs assessment and how we're updating that. So I think we need to probably do that a bit of a plan in the summer and then send updates during the year. But also we do need to sign off the pharmaceutical needs assessment, which will be going out for consultation in the autumn. So we'll just bring that forward. That's more of a kind of administrative process we need to go through and sign that off.
Thank you, Simon. Patricia Stallard.
Thank you, Chairman. It's nothing new. It's just to draw people's attention to under the starting well paragraph, the Joint Hampshire and Isle of Wight Children and Young People's Mental Health and Emotional Wellbeing Local Transformation Plan. It was last reviewed in December 2019. It was due to be refreshed annually in December 20. Well, looking at this, it wasn't. So can we make sure that it goes in the diary for at least this coming December? That'll be biannual rather than annual.
I'll pick this up, Councillor Stallard. Thank you.
Okay.
Thank you.
Tricia Hughes.
It was just a suggestion, Chair, in terms of a future item, bearing in mind the level of interest around planning, which has come out from various different aspects of the conversation, actually whether it might be following on from the really excellent presentation around transportation that we had today, whether we take that on to the next stage and actually have some of our colleagues from planning coming to talk to us about the opportunities to build in good health into future developments into a future meeting. It just seemed that there seemed to be a real energy associated with that, and I thought I'd put that offer out there.
Thank you, Patricia. You seem to be getting a lot of agreement, so yes, certainly. Any suggestions from anyone else? No? We're only 5 minutes over time. Oh, Nicola.
Oh, sorry to be last minute. I actually think we should be brave and ask for some organisational support around how we behave in the new world. And I think we should allocate some facilitated time to talking about our cultural differences so that we work better together in the new world.
Thank you. We'll take that on board and see what we can do. Okay. Anyone else? No last minute. Right, we're only 5 minutes over time, which is quite unusual for us. We're normally a lot longer than that. So thank you all very much. And the next formal meeting of the board is scheduled for Thursday, the 1st of July at 10 o'clock. And who knows, we might actually be able to meet in person by then. Maybe not, but maybe. We can live in hope. Okay, thank you all very much. Thank you. Bye.
Thank you, everyone. FM